Welcome to Connected by Health. I'm Dr. Krishna Vedala. This is where medicine meets leadership, innovation, and humanity with one goal: to add value and help change healthcare for the better. If you believe health is about more than a diagnosis, you're in the right place. Welcome back to Connected by Health. Well, today I want to talk about artificial intelligence, but probably not in the way that you're expecting. We're not going to spend the next 30 or 40 minutes talking about whether ChatGPT can pass a medical exam. We're not going to debate whether AI will replace doctors. And we're not going to focus exclusively on algorithms diagnosing cancer or writing clinical notes. Instead, I want to talk about something much more physical, something enormous, something increasingly being built across America: AI data centers. Because whenever we talk about artificial intelligence, we tend to use words like cloud, digital, and virtual. But there's nothing virtual about the infrastructure behind AI. AI requires enormous buildings filled with servers and specialized computer chips. The computers require electricity, they produce heat, the heat has to be removed, cooling can require water, electricity has to come from somewhere, transmission infrastructure has to carry it, backup generators have to keep facilities operating when the grid fails, and communities, like ourselves, have to accommodate all of this infrastructure. So here's the question I want to explore today. What if the infrastructure powering the future of healthcare also has the potential to affect our health? Because AI data centers present an extraordinary contradiction. They could help us diagnose cancer earlier, they could help accelerate drug development, they could even help physicians spend less time documenting and more time with patients, they could help predict epidemics, they could potentially democratize access to medical expertise. But the infrastructure powering those breakthroughs can also consume tremendous amounts of electricity and water, contribute indirectly to air pollution depending on its energy sources, and put pressure on electrical grids, create environmental justice concerns, and potentially widen healthcare disparities. That doesn't mean we should stop building AI. It means we need to start thinking about AI infrastructure as a public health issue, and that's what we're going to do today. So, we need to first begin with one of the biggest misconceptions about artificial intelligence. We often say information is stored in the cloud. It sounds almost weightless. You upload something to the cloud, you ask an AI model a question through the cloud, your hospital stores information in the cloud, but to be realistic, the cloud isn't really floating above us. The cloud is infrastructure. Somewhere out there, there is a physical computer processing that information, and increasingly that computer is located inside an enormous data center. Imagine a warehouse, but instead of boxes, it's filled with rows and rows of servers. Those servers may contain thousands of specialized processors. Modern AI relies heavily on graphics processing units, or also known as GPUs, and other accelerators capable of performing enormous numbers of mathematical calculations simultaneously. Training a sophisticated AI model can require huge clusters of these processors working continuously. And then after the model has been trained, millions of people may interact with it. Every prompt requires computation. Every image generated requires computation. Every medical record summarized requires computation. Every radiology image analyzed requires computation. Every protein modeled requires computation. And when billions of these interactions occur, the infrastructure requirements become enormous. That matters because healthcare is becoming one of the most data-intensive industries in the world today. So why does healthcare want AI so badly? Well, think about what a physician encounters during an ordinary day. Obviously, I'm a primary care physician, so this is not difficult for me to do. But for all of you that are not in the medical field, just think about it. These are some of the things that physicians see on a day-to-day basis: electronic health records, laboratory results, imaging reports, consultation notes, medication lists, insurance requirements, clinical guidelines, messages from patients, hospital records, preventative care recommendations, drug interactions, prior authorization requirements. Of course, we could never forget prior authorization requirements from the insurance companies. And obviously, increasingly information from wearable devices and remote monitoring systems. The amount of information that's available to clinicians has exceeded what any human being can reasonably process. That doesn't mean physicians aren't capable. It means modern healthcare generates more information than the human brain was actually designed to continuously integrate. That's where AI becomes extremely interesting. AI can potentially examine enormous data sets and identify patterns humans may overlook. Consider medical imaging. A radiologist may evaluate hundreds of images during the shift. AI systems can potentially highlight suspicious abnormalities. That doesn't necessarily mean AI is going to be replacing the radiologist. It means giving the radiologist another set of eyes. I do want to tell this on a personal note. For a decade, we've been hearing now that AI would replace radiologists. It still has not, and now we're short of radiologists because people are worried about going into radiology, that they may not have a job down the road. Instead, AI is not to the level where it can replace a radiologist, and we have a significant shortage of radiologists. But including radiology, you can also look at pathology. And in the field of pathology, AI can analyze digitized tissue samples. In ophthalmology, algorithms can identify patterns associated with diabetic retinopathy. In cardiology, AI can analyze electrocardiograms and imaging. And in primary care, AI's tools can summarize medical records or draft documentation. And one of the most immediate benefits may actually be far less glamorous than curing cancer. It may simply be reducing administrative burden. Physicians spend enormous amounts of time documenting care, and if AI can safely reduce that burden, physicians may be able to spend more time actually talking to us, the patients. That could improve the human side of medicine. And there's an important irony there. Sometimes, technology can actually make healthcare more human, even if it removes the technological burdens already separating doctors from patients. But all of this requires computing infrastructure. Here's another place where AI can really help us, AI when it comes to drug discovery. Let's move from the clinic into the laboratory. Developing medications is extraordinarily difficult. Researchers may begin with thousands or millions of potential compounds. Most will never become medications. Many fail during lab testing. Others fail, of course, in animal studies. And there's others that fail during clinical trials. Some may work, but produce unacceptable side effects. The entire process can take many years and enormous financial investment, and AI could potentially change parts of that process. Machine learning systems can analyze molecular structures and predict what compounds are more likely to interact with particular biological targets. AI can help researchers prioritize candidates. It can analyze enormous scientific data sets. It can search for medical literature, it can model proteins, and it can help scientists identify relationships that would be extraordinarily difficult to find manually. We're already seeing computational approaches applied to cancer research, infectious disease, metabolic disease, rare diseases, and antibiotic discovery. This is particularly important when we talk about antimicrobial resistance. Imagine being able to computationally screen enormous chemical libraries for molecules that might work against resistant bacteria. That doesn't eliminate laboratory science. It doesn't eliminate clinical trials. It doesn't eliminate regulatory review. You see, AI is not magic, but it can potentially narrow the search space. Instead of asking researchers to search through millions of possibilities blindly, AI can say, hey, let's start with these instead. And if that saves even a few years in the development of an important therapy, the health impact could be tremendous. Again, though all of these calculations have to happen somewhere, inside physical infrastructure. Another field where AI can really improve is precision medicine. Now imagine medicine 20 years from now. Instead of choosing treatments primarily from population averages, your physician may have access to sophisticated models incorporating your genetics, medical history, medications, laboratory values, imaging, lifestyle factors, family history, and potentially continuous data from wearable devices. The goal would be to answer a question medicine has struggled with forever. What treatment is most likely to work for this particular patient? Not the average patient, not the patient represented in a textbook, but you and me. That's the promise of precision medicine. Genomics make this particularly interesting. A human genome contains 3 billion DNA base pairs. Analyzing genomic information across large populations creates staggering amounts of data. But with enough computing power, researchers can search for patterns connecting genetic variation to diseases, medication response, and prognosis. Cancer care may become increasingly personalized around the molecular characteristics of an individual's tumor. Pharmacogenomics may help determine which medications a person is more likely to respond to or experience side effects from. But again, precision medicine requires enormous amounts of computation. AI healthcare isn't simply a software revolution, it's an infrastructure revolution. Now, let's move on to something I'm very passionate about, and that is public health. Because what applies to individual patients also applies to entire populations. COVID-19 demonstrated how valuable timely information can be. Imagine AI systems integrating emergency department visits, laboratory results, wastewater surveillance, pharmacy trends, viral sequencing, travel patterns, climate information, and other public health signals. An unusual pattern appears. Emergency departments in several communities suddenly report increases in respiratory illness. Wastewater shows increasing viral concentrations. Pharmacies report increased purchases of fever medications. Laboratories identify an unusual pathogen. An AI surveillance system could potentially connect these signals faster than traditional reporting systems. That matters because during an outbreak or pandemic, days matter. Sometimes hours matter. AI may help predict heat-related illness. It may also help identify communities at risk during wildfires. It may help model mosquito-borne disease. It may help allocate public health resources, and it may help us prepare better for future pandemics. This is where AI infrastructure begins looking almost like traditional public health infrastructure. We don't question whether public health laboratories are infrastructure. We don't question whether emergency communication networks are infrastructure. Eventually, large-scale computing capacity may be viewed the same way. But here's where the story becomes complicated. Because the infrastructure that helps us predict health problems can also contribute to environmental pressures. What do I mean by that? Well, it's pretty simple. AI requires electricity. See, this is where the energy question comes from. And it just doesn't require a little bit of electricity, it requires a lot of electricity. The exact amount varies dramatically depending on the size of a data center, the hardware, how intensively it's used, cooling technology, climate, and efficiency. But the broader trend is clear. Data center electricity demand is growing rapidly, and AI is one of the major drivers. Why should healthcare professionals care about electricity demand? Because electricity generation can affect health and public health. If increased demand is met with wind, solar, nuclear, hydroelectricity storage, or other low-emission resources, the public health consequences may look very different. But if additional demand requires increased fossil fuel combustion, then AI growth can indirectly contribute to air pollution and greenhouse gas emissions. And air pollution is not an abstract environmental concern. We can't ignore that, because that is a medical concern. Fine particulate matter can penetrate deeper into the lungs and enter the bloodstream. Exposure has been associated with cardiovascular disease, respiratory disease, asthma exacerbations, stroke, adverse pregnancy outcomes, and premature mortality. So think about that contradiction. We could theoretically build an AI system capable of identifying cardiovascular disease earlier while generating the electricity powering that system in a way that contributes to cardiovascular disease. That's the paradox that policymakers have to address. The answer isn't abandoning AI. The answer is making the energy transition part of the AI strategy. If we're going to dramatically increase electricity demand, then we should simultaneously invest in cleaner generation, transmission, storage, and grid resilience. AI policy and energy policy can no longer exist in separate rooms, and neither can healthcare policy. Now, while electricity gets most of the other attention, we keep forgetting about another important resource: water. Water is the one that we really need to discuss. Computers generate heat. Lots of computers generate lots of heat, and servers have to remain within safe operating temperatures. Data centers use different cooling technologies depending on what they're trying to do, and water requirements vary substantially. Some large facilities can consume significant quantities of water directly for cooling. There's also indirect water use associated with electricity generation. This becomes particularly important in water-stressed regions. Imagine a community experiencing prolonged drought. Residents are being asked to conserve water. Agriculture needs water. Businesses need water. Hospitals need water. And now a large data center wants water. That creates legitimate questions about allocation, and healthcare has an enormous stake in water security. Hospitals depending on reliable water supplies for sanitation, sterilization, cooling, food preparation, laboratories, and basic patient care all will be at risk with large AI data centers. Dialysis, which is used for chronic kidney disease, is particularly water intensive. Nursing homes require reliable water. Public health depends on sanitation. So when evaluating new data center projects, water cannot simply be treated as an engineering footnote. It should be considered part of community health planning. And importantly, there are solutions. Closed-loop cooling, air cooling, reclaimed water, improved chip efficiency for computers, locating facilities where water resources can support them, designing facilities around regional environmental conditions. Innovation doesn't have to stop. Infrastructure simply has to become smarter. So now that we talked about energy and water, we also need to look at something else, and that is something that hospitals understand extremely well, and that is reliability, or the electrical grid. A power outage at your house is inconvenient. A power outage inside an ICU can be catastrophic. Hospitals therefore have extensive backup systems, but healthcare still depends fundamentally on the electrical grid. Ventilators require electricity. Operating rooms require electricity. CT scans and MRIs require electricity. Medication refrigeration and electronic health records require electricity. Increasingly, healthcare is electrified, and AI data centers add enormous new load to the same grid. This doesn't automatically mean the grid will become unreliable. In many cases, large new customers can actually help finance infrastructure improvements, but it does mean planning becomes essential. See, transmission takes time to build. Power plants and substations take time to build. Meanwhile, AI development is moving extraordinarily quickly. Technology companies may want data centers operational within a few years, but electronic infrastructure often operates on much longer timelines. That mismatch deserves attention because healthcare should not find itself competing for grid reliability with rapidly expanding industrial electricity demand. We need enough capacity for both. So, we also need to look at another important aspect when it comes to data centers, and that is backup generators and local air quality. Because data centers are designed to remain operational. That means redundancy. Historically, one component of that redundancy has been diesel backup generation. Those generators aren't necessarily running continuously, but they require testing and they may operate during grid emergencies. Diesel combustion produces nitric oxide and particular pollution. This becomes particularly important when many facilities are concentrated in one region. A single generator may not define a community's air quality, but public health doesn't evaluate exposures in isolation. Communities experience cumulative exposure. Traffic, industrial facilities, power generation, construction, backup generators, wildfire smoke, and other sources. So when planning AI infrastructure, regulators should therefore ask not only, does this individual facility meet regulatory limits, but also should look at and ask themselves, what is the cumulative health burden on the community where we're putting it? That's a much more meaningful public health question. And that brings us to another important topic, and that is environmental justice. Historically, infrastructure burdens haven't always been distributed equally. Highways, factories, power plants, waste facilities, industrial corridors. Lower income communities and communities with less political power have often carried a disproportionate share of environmental exposure. We cannot repeat that pattern with AI infrastructure. Imagine wealthy communities receiving the benefits of AI-powered medicine, while disadvantaged communities disproportionately experiencing pollution, water stress, construction impacts, or higher infrastructure costs associated with powering it. That would be fundamentally backwards. The communities bearing the infrastructure burden should also participate in the economic and technological benefits. That means jobs, that means education, workforce development, tax benefits, broadband, community investment, environmental protections, and, of course, transparency. AI shouldn't simply extract resources from communities. It instead should create value for them. So here's the other problem, and this is now becoming an equity issue. Who actually gets access to healthcare AI? Let's imagine two hospitals. Hospital A is a massive academic medical center. It has sophisticated electronic health records, data scientists, cybersecurity teams, AI governance committees, and enormous financial resources. Hospital B, on the other hand, is a small, rural hospital struggling to keep its emergency department staffed. Which hospital adopts advanced AI first? Probably Hospital A. And that's concerning because some of the communities that could benefit most from technology are precisely the communities with the fewest resources to implement it. Consider rural healthcare. A rural community may have limited access to radiologists, dermatologists, neurologists, psychiatrists, and other much-needed specialists. AI could potentially help extend expertise into those communities. AI-supported imaging could assist clinicians. Remote monitoring could help manage chronic disease. Telehealth could become more sophisticated. AI translation could improve communication. Clinical decision support could help clinicians practicing far from major academic centers. But none of that matters if rural hospitals cannot afford the technology. So we have to ask, will AI become a tool that reduces disparities, or will it become another expensive medical innovation that wealthy systems receive first? That is a policy choice. It isn't inevitable. It isn't inevitable. Now let's talk about, of course, another important aspect of AI, something that concerns every one of us, especially given one recent AI agent that has hacked into another AI competitor. And this is the issue of cybersecurity. Healthcare is already an attractive target for cybercriminals. Hospitals hold incredibly sensitive information: names, addresses, social security information, insurance information, diagnoses, lab results, medications, financial information. But there's something even more important, and hospitals cannot simply stop operating. A bank can temporarily close, a retail website can go offline, an emergency department cannot. A hospital cannot stop operating. And as AI becomes embedded into healthcare operations, the infrastructure supporting AI becomes part of patient safety. Imagine a hospital relying on AI to prioritize imaging studies. Then the system goes offline. Imagine AI supporting medical reconciliation. Then access disappears. Imagine a cyber attack corrupting the information an algorithm uses. Now we're no longer just talking about privacy. We're talking about clinical reliability. AI systems need fallback plans. Hospitals need redundancy. Clinicians need to understand how to function when AI is unavailable. And cybersecurity must be designed into systems from the beginning, because the more dependent healthcare becomes on AI, the more consequential AI failure becomes. There's another risk that has nothing to do with electricity or water: overdependence. AI can help physicians, but physicians cannot surrender clinical judgment to algorithms. Every model has limitations, every dataset has biases, every algorithm can make mistakes. If an AI system produces an incorrect recommendation confidently, will clinicians recognize it? Medical education will have to evolve. Future physicians won't simply need to know how to use AI, they'll need to know when not to trust AI. That's a profoundly important distinction. AI literacy should become part of healthcare education. Physicians should understand bias, data quality, model limitations, privacy, automation bias, and the difference between correlation and causation. AI should augment clinical judgment, not replace it. So we've discussed a lot of concerns so far, but we shouldn't lose sight of the opportunity. AI brings in a lot of opportunity. The AI infrastructure can generate economic development. Building data center requires electricians, engineers, construction workers, technicians, cybersecurity professionals, networking specialists, energy infrastructure, and advanced manufacturing. Communities can build education and training programs around those industries. Universities can partner with technology companies. Medical schools can collaborate with computer science departments. Hospitals can work with researchers. Biotechnology companies may cluster around computing infrastructure, and that creates an interesting possibility. What if communities didn't simply build AI data centers? What if they built health innovation ecosystems around them? Imagine combining computing infrastructure with medical research, genomics, public health analytics, drug discovery, medical device development, healthcare startups, and university research. Suddenly, the data center isn't merely a giant building consuming electricity. It becomes part of an economic and scientific ecosystem. That's the opportunity we should be pursuing. But here's the important question that we all have to ask. And this is a very important economic question. Who pays? When enormous data centers arrive, utilities may need new substations, transmission lines, power generation, water infrastructure, road improvements, and other public investments. We should carefully examine how those costs are distributed. Ordinary families shouldn't see dramatically higher utility bills because infrastructure upgrades were designed primarily for massive corporate customers. Hospitals shouldn't face significantly higher electricity costs because the grid is trying to accommodate unprecedented new demand. Small businesses shouldn't subsidize infrastructure built primarily for enormous technology companies. That doesn't mean that data centers shouldn't be built. It means the financial structure should be transparent and fair. Companies benefiting from massive infrastructure investments should bear an appropriate share of those costs. That's basic economics, and it's also healthcare policy. Because when hospital utility costs rise, those costs ultimately enter the healthcare system. So, there's also the opportunity cost. Every society, as we know, has limited resources, whether that is money, land, electricity, water, of course, political attention, engineering capacity. But what we should be asking ourselves is whether the massive investment in AI infrastructure complements our healthcare priorities. Because America's healthcare system still has enormous basic needs: primary care shortages, mental health shortages, rural hospital instability, maternal health challenges, public health workforce shortages, preventable chronic disease, issues with medical affordability, healthcare worker burnout. And I'm familiar with all of these. But AI isn't going to solve all those problems. And we shouldn't allow excitement around technology to distract us from basic public health investments. Sometimes the most important healthcare intervention isn't an algorithm. It's a primary care physician, a nurse, a community health worker, or a vaccination clinic, a mental health counselor, clean drinking water, healthy food, and safe housing. AI should amplify those investments, not replace them. So, what would responsible AI infrastructure look like? How do we actually do this? What do we actually do? I think what we need is a public health framework for AI infrastructure. First and foremost, clean energy. If AI is going to dramatically increase electricity demand, we should simultaneously accelerate development of low-carbon electricity and grid infrastructure. Second, water stewardship. Communities should understand exactly how much water facilities expect to consume, where it comes from, and how companies plan to reduce consumption during drought. Third, grid resilience. Large industrial customers should contribute appropriately to transmission and generation infrastructure. Fourth, air quality protections. Backup generation and other sources of emissions should be evaluated within the context of cumulative community exposure. Fifth, health equity. Rural hospitals and safety net institutions should have pathways to access useful AI technologies. Sixth, cybersecurity. Healthcare AI infrastructure should be treated as critical infrastructure. Seventh, transparency. Communities deserve to know what resources these facilities consume and what benefits they receive in return. And eighth, and finally, health impact assessments. Before approving enormous projects like AI data centers, policymakers should consider not simply economic development, but also potential effects on population health. We've done environmental impact assessments for decades. Why shouldn't health impact become part of the conversation? So, I want to end today by changing how we think about AI. AI simply isn't an app. It's not simply ChatGPT. It's not an algorithm. It's incredibly becoming infrastructure. And once something becomes infrastructure, society has to think about it differently. We regulated electrical grids because electricity is essential. We regulate drinking water because water is essential. We build roads because transportation is essential. We fund hospitals because healthcare is essential. And we protect telecommunications because communication is essential. And if AI becomes deeply integrated into medicine, finance, education, government, transportation, and national security, then the infrastructure supporting it becomes increasingly important to society. And healthcare leaders need a seat at that table. Physicians have to participate in these conversations. Public health professionals have to participate. Environmental scientists and engineers need to participate. You and I, as patients, we should participate. Our community should participate because technology decisions increasingly become health decisions. So, in summary, think about the strange paradox we discussed today. Somewhere in America, a massive computer cluster could be analyzing molecules that eventually produce a life-saving cancer medication. Another model could help identify sepsis or infection earlier. Another could help a rural physician interpret a difficult diagnostic study. And another could predict the next infectious disease outbreak. Another could reduce hours of documentation for thousands of exhausted physicians. Those are extraordinary possibilities, but the computers doing that work require electricity. They generate heat, they require water, they rely on electrical grids and backup systems, they occupy physical communities, and they create costs as well as benefits. The question isn't, should we have AI data centers? That debate is already being overtaken by reality. AI infrastructure is being built. The better question is, how do we build it in a way that improves health rather than simply increasing computing power at the expense of public health? Because technological progress and public health don't have to compete. We can build data centers powered increasingly by cleaner energy. We can invest in water-efficient cooling. We can strengthen electrical grids. We can protect communities from pollution. We can make technology accessible to rural hospitals. We can build strong cybersecurity protections. We can train physicians to use AI responsibly, and we can ensure communities sharing their resources with AI share their benefits also. The future of healthcare isn't simply artificial intelligence. It's what we choose to do with artificial intelligence. And perhaps more importantly, it's how we choose to build the infrastructure underneath it. Because, my friends, healthcare is connected to energy. It is connected to water. It is connected to the environment. It's connected to technology. It's connected to economic policy. It's connected to infrastructure. And ultimately, healthcare is connected to everything. Thank you so much for listening to our episode today by Connected by Health. If today's episode made you think differently about artificial intelligence, share with someone who thinks artificial intelligence is only about software. Because some of the biggest healthcare decisions of the artificial intelligence era may not happen inside hospitals. They may happen inside utility commissions, city councils, state legislators, technology companies, and enormous windowless buildings filled with computers. I'm Dr. Krishna Vedala, and we'll see you next week again with another fantastic episode. Until then, don't forget, we're all connected by health. If you found this conversation valuable, share it with someone who could use it. And if you're on Apple, we'd love to hear your favorite takeaway and a review. See you next week.